And welcome back. You are watching OpenLine. We are glad that you are spending some time with us this evening here with Dr. Karen Ray, psychiatrist. We are talking about new innovations in mental health treatments, mental illness. It's very encouraging, very exciting forays into this field, which we are discussing throughout this hour. A lot of you have been calling in with some questions and comments. I encourage you to do so. Again, if you are just tuning in, we love that you are, and we say often, this is your forum. This is your chance to ask the question, make the comment. We only have about 30 more minutes, so do get on the line when you can. Right now we're going back to the lines. Dot is on the line with us, and Dot, thank you so much for being with us this evening. Do you have a question or a comment for Dr. Ray?
Yes, and thank you, Chuck, and thanks to the doctor.
Absolutely.
I used to work with you, and I really appreciate your shows when you're on TV.
Well, it's nice to hear from you.
Thank you.
Yeah.
I'm calling because about bipolar.
Mm-hmm.
Why is it misdiagnosed so often, and how is it diagnosed?
Okay.
Well, I think bipolar is often misdiagnosed as regular unipolar depression because the first episode is frequently a depression episode. So bipolar is diagnosed either because the patient presents with mania, too much energy, talking fast, making bad choices, or it can, over time, there will be a depressive episode, another depressive episode, and then a manic episode. So to make that diagnosis, we really have to wait until we see a manic episode. And it's really important to make that diagnosis because the treatment is quite different. So I think you're really right to be concerned about this. And in the past, it's taken years sometimes for people to get the correct diagnosis.
And that was, Dot, I'm glad that Dot called about that and asked that. So, Dot, thank you so much this evening for tuning in and for giving us a call.
Thank you, Chuck. I remember the good times at our workplace. Appreciate it.
You're very welcome.
Bye-bye.
Have a great evening. Good to hear from you. All right. So that was one of the questions that I was going to ask you, though, as well, is how long does it take to determine if it's bipolar, you know, or...
Well, I think there is currently a move to look at family history and sometimes to add a mood stabilizer in to a patient that is suspected of being bipolar. But it's really rather difficult if they present with a regular depression. Because we treat depression as depression, but we always have to be thinking that people who aren't doing well with our treatments might in fact have bipolar disorder.
Okay, and I do have a couple more questions about that bipolar, and we'll try to get back to those as well, but right now we are going back to the lines, and Cherie is on the line with us. And Cherie, thank you for your patience, and we're glad that you called in this evening. Do you have a question or a comment for Dr. Ray?
Well, eventually a question,
okay.
But I am a patient at Centerstone, and I have a wonderful therapist. She's just fantastic, and a doctor. I have been on numerous medications for bipolar, so it's been a trial and error kind of thing. But now they have me on Trileptal, and I requested that because I've done a lot of research, even though that medicine's not been actually, I guess, approved for bipolar. It's helping a lot of people who are bipolar, and I just wondered why that it hasn't been approved. And also, there have been times when I have not taken my medication, and I get in trouble on those manic episodes where I will do something completely crazy, dangerous. What happens in your brain to cause you to do those kind of things if you're not on medication? I don't understand, and it's scary when I look back on it, and I'm like, how did I ever do that? And I get upset with myself.
Well,
okay.
it's a very difficult illness, and it sounds like you have a lot of insight into how much you need to stay on your treatment.
Oh, yes, yes.
I think Trileptal has been studied in several studies for bipolar disorder. It does appear to be helpful in some groups of patients, but overall it doesn't have the most robust data like lithium, for instance. But it really varies by person, and I think if it's helping you, that's really important. There is a lot of work going on to try to understand bipolar disorder. I'm not sure anyone could tell you exactly what goes on in your brain that makes you, I mean, that's what the object of much of the research is to understand the sort of basic causes of mental illness. But I think you're asking the right questions, and the fact that you've found something that works and that you've found a great therapist is really important.
Oh, yes.
Well, Cherie, we really appreciate you calling in this evening.
Well, thank you for your time. I really appreciate it.
All right, have a great evening.
You too.
Thank you so much. And on that note, and people are continuing to call in, and we appreciate that, and we'll get right back to the phone very shortly. But on bipolar, what has the treatment in treating bipolar changed over the years?
Well, I think we have a new class of medications, or at least many new members to that class, and that's the atypical antipsychotics, Risperdal, Zyprexa, Seroquel, and others in that category, quetiapine, Latuda. So we have a number of newer medicines that work very well to stabilize mood. We've had lithium before, we've had Depakote, and of course, as she mentioned, Trileptal works for some people. Those are sort of neurology medicines that were used for seizures, but they tend to be mood stabilizing. But this new class of medication has become very important and rather effective. We just have to get the diagnosis right and then help people stay on the medication that works.
Okay, great to know. We are going back to our lines, and again, a lot of you calling in, and thanks for your patience, and thanks for calling. Leslie is on the line with us right now, so Leslie, welcome to the show. Do you have a question or a comment for Dr. Ray?
Yes, I am being treated for depression with transcranial magnetic stimulation, and I wanted to know the doctor's views on that and also on electroconvulsive therapy.
All right.
Well, I'm going to answer in reverse order. Electroconvulsive therapy has been around a very long time. It is extremely effective for severe depression. It is not used as much because not so many people really are that severe or really want to pursue that. Transcranial magnetic stimulation is certainly gaining more data to support its effectiveness in depression. As I go to conferences, I'm hearing much more about it. And it does require that a patient go frequently for sessions for a number of weeks. And so I think that is sometimes an issue, is the distance to the person who has the machine and whether they're actually able to go. Do you go 5 days a week?
Yes, ma'am.
And how many weeks will you be going for?
For a total of 30 treatments.
Right, and I'm assuming you've been treated with various medications before?
Yes, ma'am.
Well, if it's working for you, that's fantastic, and it is beginning to get a lot more support in treating depression.
Okay, thank you for your thoughtful answer.
And Leslie, and I think you were saying, and there was the other question that she had
was about ECT, which I mentioned first.
So,
electroconvulsive therapy.
That was originally recommended to me.
And I think you picked what many people would before you go to ECT, but ECT is really effective and it's still out there for you.
That's what the doctor tells me. He originally wanted me to have the ECT, but I just don't have the support system
right.
to do that without in-hospital treatment.
Sure.
Okay. So, well, again, thank you so much, Leslie, for calling in this evening, and you have a great evening.
Thank you. Thank you both.
You bet. All right, we have a lot of callers with us. I have questions, but I want to get to the callers' questions. We are going to go to line 1 right now. Connie is on the line with us. So, Connie, thanks for your patience. We are glad that you are watching this evening. And do you have a question or a comment?
I have a question.
Sure.
I am being treated for depression. I'm on 25 milligrams of Zoloft. Now, I've been treated for numerous different things, especially bipolar, and I've been on bipolar medication, several different ones. At one time, a doctor or a psychiatrist had me on like 4 or 5 different medications at one time, and they made me talk nonstop. But what my symptoms are is I don't enjoy doing what I used to do. I'm gaining weight. I'm just not happy, and my mind races constantly. And it's like when I can be happy 1 minute, or not really happy, but fine 1 minute, and then something can happen. Somebody can say something, and it's like a switch flips in me, and I just get really, I'm not going to say angry because I don't get angry. I get very disappointed and very aggravated.
Well, I think with bipolar disorder, there's a lot of mood instability. So a lot of fluctuation like you're describing, and that's really one of the reasons that we recommend using a mood stabilizer. I understand your issues with the weight gain. Many antidepressants do lead to some weight gain, and it's interesting, gaining weight often is related to the antidepressants that are very effective. But I think going back to the idea that you might have bipolar disorder instead of just regular depression would be important for you, because Zoloft is good for regular depression.
Okay.
All right, Connie, if you would, hang on the line with us, and we will get you some information, if you would, and we will get right to you, okay?
Thank you.
All right, thank you so much for calling in. We really appreciate it. We are going back to our lines right now. Kelly is on the line with us, and I think we have time for Kelly's call before we go to break. So, Kelly, thank you for watching this evening, and do you have a question or a comment for Dr. Ray?
I do. Thank you so much for providing this information for us in the viewing audience. My question is, I've been treated for depression and have been taking paroxetine or Paxil for many years, and I do fine with it. I appreciate that if I take my medication regularly, I don't have the bouts of depression. But I'm just curious if the 40 milligram a day is considered a very large dose, or if that's a mild dose, or if that is just the average.
Well, I think 20 milligrams for a long time was considered the average dose. So 40 is, a little bit more than average. But it sounds like you've probably not needed to increase your dose for a while, that it's been effective at that amount.
That's correct.
So, I think sounds like that's the right dose for you.
Wonderful. Thank you. I just wanted your perspective, and I appreciate it.
Sure thing.
Well, and again, Kelly, we thank you for calling in this evening, and you have a nice evening.
Thank you, y'all, too.
Thank you very much. All right. We are going to take a break, I believe, right now, and we'll be back. And like I said, we have some people holding. We'll get some information to them. Be patient. We do have a lot of folks on the line with us right now, but we will get to as many questions as we possibly can in the remaining about 18, 19 minutes. So we'll take a break, and we'll be right back after this.